Much, and good morning. My staff always prepares, notes for me, but in order to talk about healthcare, I don't actually need notes because I just have to talk about my life. And I had the great privilege and opportunity to be able to share just a little bit of that in a few minutes with the nation and in support of the president. I went to some of the best schools around the country, and my parents really, did a tremendous job to make sure that all of us got the education that we needed, because they knew that education was a key to success. And in doing that, so I went to college at Wake Forest University, and that was, really great. And like a lot of, college students, you come out of college and you're like, okay, now I can take on the world, and you think you know everything. I tell that to my son now, who's 24 and kind of just out, and he thinks he knows everything. And every once in a while he has to send me a text message that says, Mom, thanks, because I didn't know everything. Some little things. So that is true. And so I came out, like lots of people, working really hard. And then sometime later, after spending some time at Lockheed working on the space program, the Space Lab program at Goddard Space Flight Center, I then went to law school. And in the course of that, I'd gotten married, and like many of us who get married and we're younger, and we think that it's going to be forever because that's what we want, and sometimes it just doesn't work out like that. And so I found myself both single and a single mom with a young child. And although my son had health insurance, I was really fortunate. He was able to have health insurance with his father. I was working every day and not making a ton of money, even though I was a lawyer. And people, when you talk to folks and they say, "Oh, you're a lawyer," and they get all these, dollar signs must cross their mind or something, But I wasn't a country lawyer, but I was a lawyer working in the nonprofit sector, working on issues of domestic violence and sexual assault and consumer protection. And that's the kind of law stuff where you don't make a ton of money, but you get a lot of reward. And but unfortunately, because it doesn't pay a lot and benefits cost a lot, and a lot of our nonprofit organizations aren't able to offer the kind of robust health care that and insurance that we need. And I found myself working every single day, working really hard, and I didn't have health insurance, and mostly because it was offered, but it was way too expensive, and I was juggling, the things that women do. You juggle daycare and your rent and your mortgage and your utilities, and some months Petco takes the top of the list, and other months WSSC takes it, and other months something else takes it. And you juggle daycare, and I know some of you know that if you're, I don't know what the late fee is now for moms, but I know my late fee was $1 a minute. You sit in rush hour traffic, and it's like 12 minutes after the hour, and you're like, okay, that's $12, and then it's 18 minutes after the hour, and that's $18, and you do that on a fixed income enough times during the week, and it just takes the space of something else. And so I didn't have health insurance. And I did, like a lot of people do who don't have health insurance. Our health insurance is this. It's called crossing your fingers and hoping that you don't get sick. And what happened was I got what I thought was a cold. Sounds like I have that now. I got a cold, and I was, I could take the $4 or whatever it was to go get some Robitussin, because I come from a family where Robitussin pretty much cures everything. And so you take that, but it wouldn't cure that cough, and the pain of it got deeper and deeper, and I couldn't breathe. And one evening, I was in the produce section of the Giant food store, where I still go shopping at my Giant food store over in Fort Washington, Maryland, and I just saw this like fuzziness come by, and I passed out in the middle of the grocery store. And I was taken by emergency transportation ambulance to Prince George's Hospital. And Prince George's Hospital is one of these hospitals, like a lot of hospitals, that take care of a lot of people with uncompensated care, because people still go to the emergency room when they're sick. it's just that there's nobody to pay for it except all of us. We're all, paying for it, and our premium cost and the way that we pay for our health insurance. And so they took me to the emergency room, and the folks, the good nurses and doctors at and medical personnel at Prince George's Hospital were really, really terrific. They asked me whether I had insurance, but I did say no, but they didn't say see you later. They treated me. And it was difficult. I was on a respirator, and the whole 9 yards. It turns out I had been walking around with pneumonia for some time, and my lungs had just basically given out. And in describing that, you can imagine, if you're sitting there and you have no insurance, and you're like, gosh, just get me out of here, because it's like the dollar signs just adding up and adding up. As a result of that, they treated me, and then I got well, and I got my antibiotics. It turns out it doesn't take a lot of antibiotics to cure all that infection stuff. It's not very costly. And I thought about this later, probably $100 office visit to a doctor early on, maybe 20 bucks in antibiotics, and there you got a cure for 120 bucks. And instead it was thousands and thousands of dollars, because rather than the $120, it was an emergency room visit, it was a respirator, it was highly paid and effective emergency room personnel. And at the time I was in the process of buying my house, and so then that happened, and then the next thing I've got these bills, and when you have these kind of bills, and before the days of caller ID, you didn't know who was calling. But if the phone was ringing between the time you got home from work and 9 o'clock in the evening, you just pretty much knew not to pick up the phone, because you knew it was one of them. And so I didn't pick up the phone, but I had these stacks of bills, and they just piled on. And then I had student loans, because my parents weren't wealthy, and so I went to school on loans and grants and scholarships and all the rest. And so I had huge student loans and all of that, and couldn't juggle it all. I just couldn't juggle it all. And so then the foreclosure notices, at some point or other started coming to my house. And I was still going to work every day. And I didn't do a lot of shopping. I don't do a lot of shopping now unless it's at a discount store, because some things just never leave you. But so I was getting up, getting dressed to go to my great job that I loved every single day, and still bringing the paycheck that I could to juggle. But there came a point at which I really did almost lose my home. It went on an auction sale, and fortunately at the very last minute I was able to get it back. And you wonder, there was a time when every day I would leave, and I would, in my trunk, I would put a bag in my trunk that had some extra clothes for myself and my son, and it had, I put the bag in my trunk, and I would also, put in there my important papers in my trunk too, because I didn't know if I came home, if all my stuff would be, like out on the curbside. And anyway, fortunately at that time I was able to then work with the mortgage company and all kinds of folks. I was, in the juggling part, there'd be a day a week or so that I'd stop by at a food bank, and because I had my fancy job and working every day, I would come home, put on jeans and a t-shirt and baseball cap, and I would drive to Virginia or someplace else, not in my community, to the food bank, because it was a little embarrassing. And I just share that with you because when the Affordable Care Act passed, and I went to Congress because I wanted to do health care. That's why I wanted to go to Congress, because I wanted to do health care. And even though that experience happened many years ago now, it feels like it was yesterday. And I think about the women throughout all of our communities, and particularly women of color, who find themselves on their own, and who are juggling the same kinds of responsibilities, and they're going without health care. What that means is that they find, a way to help out their kids, or even as Elijah, described, they find a way that they make sure their spouses or significant others get their health care. And you know what happens to our health care? It just goes down the tubes. So we have more aggressive cancer, and we have diabetes, and we've got stress, and we've got da-da-da-da-da-da. And then we have the highest, rates of HIV/AIDS infections anywhere that you want to find. I mean, the list is just so long of the tragedies of women's health care, and particularly African American women's health care. And so I feel really fortunate that I was able to, I can't say dig myself out, because in order to do those things, it takes a lot of us to make that happen. It takes the good fortune of, the person who's on the phone at the mortgage company who turns out is a single mom too, and so she's like very invested in trying to make sure that she can help you. Or it's the person at the food bank, and on and on and on. And until we passed the Affordable Care Act, that reality just was it's the norm of the day for so many women. And I had the great privilege when I came in, leader then Speaker Pelosi knew that I was very invested in getting, how can we get this health care reform passed? And I was chosen as one of 4 members of Congress to gavel in the debate on the House side. I have a gavel in my office from the Affordable Care Act, from the time we started until the time we finished, and she engraved it. It really means a lot to me, because it means that all across this country, women won't be put into the position that I was in our future. It means that the young kids like Deontay Driver will get oral health care. It means that we'll invest in the kind of preventive care that can keep all of us from being so sick and having a system that's based on sickness and not on wellness and on health. It means that women will have the ability to get health care and not be discriminated against, paying way more than their male counterparts do. It means that our preventive care, like mammograms and colonoscopies and cervical exams, will be paid for. It means that our older women, our mature women, as I'm getting older, I'm thinking about that a little bit, that our mature women will, into their, as they age, they will still be able to get mammograms and cervical exams. Because why is it that once you're on Medicare, all of a sudden you don't need those things and you have to reach into your pocket to pay for them? That's the difference with the Affordable Care Act. It means that we're investing in things like making sure that we're putting money into research about disease and disease prevention that's about women of color, because maybe we don't have the same health experiences that other women have, and we need to know what treatment protocols work best for us. And we don't know all of those things. And so I'm going to close and just say to you, I'm really grateful that you invited me here today. I'm always grateful to be around our Lieutenant Governor, who fights for all of us, but particularly fights for women all the time. And to be in a country where we do at least have some leadership that recognizes that we have a responsibility one to another, and that today, just because I happen to be a member of Congress and able to afford my health care doesn't mean that I don't have a responsibility for somebody else who doesn't. And so our job going forward is to make sure that we implement in Maryland and across this country the Affordable Care Act in the most responsible way, and not leave any stone unturned when it comes to our health care. And I will say, like I say to my mom, we don't really have to have the pig's feet on New Year's. We can pretend. That when we cook our greens, we could use